So now in this session, we're going to cover two-person CPR on the adult with no AED. So some of the points that we're going to emphasize here is how we're going to help each other out, because we know that doing deep 2-inch plus compressions at least 100 times a minute, if not more than 100 times a minute, that's fast. That's more than 1 a second. We know that we're going to get exhausted. It's not a matter of if, it's a matter of when. And the ideal situation is that you've got a second rescuer who's able to switch with the compressor and take over chest compression so that they can then consistently maintain those deep 2-inch plus compressions at least 100 times per minute. So we're going to basically walk through this step by step in how we're going to choreograph this so that we're not stumbling, stepping on the patient, so on and so forth, that we can continue this rescue until the next level of care arrives and takes over. So in a situation like this, we see that the person is here. We don't have our gloves on, but keep in mind that we're going to, in the practice session that we're going to follow this up, we'll have our gloves on. We need to make sure we have our personal protective equipment. The scene is safe, and now we're ready to rescue. We call out to the patient. They do not respond. We tap and shout on the collarbone. Are you okay? There's no response. At that same time, we are now looking for normal breathing or abnormal breathing, no breathing. Abnormal breathing, again, meaning agonal gasp for breath. This is not respirations. This is a drive to breathe. It's not getting oxygen circulated into the bloodstream. This person is unresponsive, not moving, not breathing. We're going to activate emergency medical services or call a code, and then we're going to check for a carotid pulse for no more than 10 seconds. This patient does not have a pulse, is not moving, not breathing. I'm going to find the center of the chest and start my 2-inch plus compressions. We're going to do this 30 times. The rescuing partner is going to then do the head tilt chin lift, really get that head back far, cover the mouth and nose with their one-way valve mask, and they're going to give 2 full ventilations of about a 1-second breath each. We're going to check for chest rise and chest fall. Chest rise and chest fall. If it doesn't rise and fall, we probably have to readjust the head because the number one obstruction in an unconscious patient is the tongue. Normally this corrects it. They're going to try again. Then we get chest rise and fall. We know the air went in. We can continue our chest compressions. We're going to do this until an AED arrives or emergency medical services or the code team comes and relieves us. When I get exhausted, I need to indicate to my partner, we need to change. I'm getting tired. So after these compressions, let's switch. 25, 26, 27, 28, 29, 30. He gives 2 more ventilations. Comes around carefully. I reposition myself with my mask.
4 and 5 and 6 and 8 and 9 and 10 and 12 and
Or
13.
in this case, I've got a bag valve mask. If you as a rescuer or you're in a clinical setting have a bag valve mask, this is optimally the thing you're going to use. It doesn't even matter if it doesn't have oxygen. There's some science now showing us that that's not as emphasized anymore in resuscitation cases. But if I have a bag valve mask, I can now use this, do my CE method of sealing the mask, give 2 nice, slow, full breaths, get chest rise and fall while the rescuer on the compressions continues. And again, we do this until the next level of care comes and relieves us, and we'll keep switching on and off every couple minutes so that we don't fatigue and stop compressing as deeply as we should.
Scene is safe. Have my gloves on, mask. Are you all right? Are you okay? No response. You in the gray shirt, go get emergency response and come right back.
Hey, Dan, I know CPR. I can help you.
6, 27. Take over as soon as I know these.
Okay.
30.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. And I do this up to 30. I would do it for about 2 minutes. I'm going to start getting exhausted. I'm going to call out, let's switch, and 25 and 26, 27, 28, 29, and 30. I happen to have a bag valve mask, so I'm going to continue ventilations with the bag valve mask. 30. 1, 2. 2 nice slow breaths. We'd continue this until you became exhausted and needed to switch. You would call it a switch, or until EMS arrived, the code team arrived, or someone equally trained was able to help take over.